Usually, we the citizens here, we don't know what the budget is. We see the budget to be something that is mystery.
The national budget hitherto was seen as a big document which sits in Accra, and all they know is the Honorable Minister being on TV and sharing information on Mr. Speaker, Madam Speaker, this, that.
For development to be complete, it must start from those who are to benefit from that developmental intervention. And before they can also come in, they need to appreciate what that particular intervention is for them and how they should come in.
Ensuring that there is openness in the system.
Making the budget work.
Making the budget work for Ghana. The question is, how do we get this sustained?
We noticed that there were a lot of financial irregularities, misappropriations, misallocations, variations in budget allocation and actual resources that are disbursed to state institutions to provide services, especially in the health and education sector. We noticed that largely citizens were uninformed about budget processes. There were opportunities for citizens to participate, but they were largely not aware of such mechanisms to influence decisions around allocations of budget. And even the mechanism that existed was quite limited. So the objective of the project, first of all, was to strengthen the institutional capacity of SEND. Then build the capacity or the institutional capacity of the PM&E network, grassroots non-state actors who are put at the center of the project. Their level of budget literacy had to be improved, their capacity to undertake budget monitoring had to be improved, and their capacity to engage and communicate on budget monitoring findings. Working together with the PM&E network members, we were more or less following the money, where we use evidence from the monitoring to actually engage and influence budget allocation.
Our overall objective was to improve access and quality of services in priority programs in the health and education sectors in 30 districts by strengthening transparency and accountability in the budget process.
Government views most of these civil societies as opponents. But in the case of St. Ghana, there is that synergy, there is that collaboration, there is that constructive engagement. Because on the steering committee, there are reps from Ministry of Education, local government, Ministry of Gender, Ghana Education Service, even Ghana Integrity Initiative.
With the support of the steering committee, some information was able to be gathered to facilitate the research work of the project. I think it's the first time that the project, which looks at not just civil society going ahead to do what they think is best, but they are actively engaging the government and its officials in achieving educational and health outcomes. And we believe that going forward, the relationship can only be better.
Honestly, the St. Ghana has really contributed in no small way to the budget process. At the local level, St. Ghana organizes budget input sessions.
At Wichao, at the Chief Palace, the budget officer took us through how the budget is prepared. The citizens were asked to select at least 3 priority projects they want to see as one of the priority projects for the health. The children ward was missing, as the community members lamented about how adults and children were being treated in the same ward. We, the DCMC members and St. Ghana, we asked the budget officer to commit to those that they will be able to do. And as a result of that, they promised that they were going to build the children ward to separate the children from the adults.
St. Ghana has really done so much well to Wild West District Assembly. They have enlightened a good number of our communities to show interest in the development of the district. Initially, a lot of people relax so much because they think whatever government brings is what they should accept. But with the education, when it comes to the budgeting and the planning, which is being championed mostly by St. Ghana, we have realized that there has been some changes in our people, the way they want to really help in contributing to the development of the district. Through their intervention and their sensitization, we're able to construct a children's ward at the district hospital.
A community called Ubu Community. Also during the sensitization, they raised a number of issues which is of concern to them. It included construction of a placenta pit.
The placenta pit for Bungu Chief's compound was one of the major challenge.
The pregnant woman, when they went there and get delivered, they have to give the placenta to the woman to send to the house or somewhere buried. And we know that some of them, they can go and dispose it anyhow.
A lot of people wanted to come here to do their deliveries, but because of our lack of the placenta pits, they do refuse to come.
Nurses were complaining bitterly that the placenta, how to dispose it is always a problem.
To get placenta pits is our main priority in my action plan as an assembly member. And fortunately, I'm part of the DCNC board. What we did was that we organized a DEBA. I informed them that my peoples, we want placenta pit, but how to get it is always difficult. We gathered the community peoples, a lot of women and men, with the elders, with the all around.
We were educated that we ourselves shouldn't be waiting for government to come and do everything for us. That we need to come out with certain areas that we want.
We did not go to anybody to give us a funds. The community, we mobilized our own resources. We allocated one particular date, and the youth, they come out with their numbers to support us for the digging of the placenta pits.
He said we are going to the chief's compound to construct a pitch in a way that when a pregnant woman delivered, they will always bury the placenta so that there will not be much exposure of these things, and then there will be diseases that will be attacking our animals and our young people going around, and even the pregnant women that are always going there to do checkups and other things.
Even some people used to give us cement. That is how we mobilized our people. Since they know the thing will benefit them, and they have seen the importance of that thing, that placental pit.
We are very impressed of such idea that is coming from the chief, and even those who are mobilizing such project for us. We are very, very happy.
It was rather very fortunate that we have St. Ghana, who always invite us to their seminars, that meeting as well, and educate us how to mobilize people for certain projects that will benefit the community as well. Anytime we go to any meeting, like they always use us as an example to other communities. For that alone, we are very, very happy. Actually, we are benefiting greatly for it.
Let me give a practical example because I'm in the Ministry of Education and for that matter, Ghana Education Service. St. Ghana has undertaken a lot of research activities into most of the interventions that government has put in place. School feeding, free school uniform and free exercise books. And there has been various issues that has come up.
Owners of private kindergarten must comply with regulatory standards within 1 year of operations. Safe and adequate infrastructure with furniture that meets standards is key to foundational education. These things must be provided to kindergarten schools.
That has gone a long way to help, for that matter, the ministry in addressing some of the challenges that without the involvement of St. Ghana, some of these challenges wouldn't have been unearthed.
Our school was in a deplorable state. You could see the building wailing away. It was just like a death trap. You can imagine one teacher teaching about 164 students in one class without furniture. It should be 35 per class. It's almost 4 classes we are combined. Sometimes you'll be teaching at one direction, the people will be playing at the other direction. People at the back, some of them do not hear you because the noise will be too much. That will drastically affecting our learning and teaching here. St. Ghana came to the community to ask them what really is confronting them.
Being a DC member, we are the link from the communities to that of St. Office. We held a community day whereby the community came out with an issue regarding to education. They said their primary school was in a very bad stage and not helpful to the kids who are attending school. We raised the matter up to the assembly, and this assembly agreed that they were going to renovate it. Then we did a follow-ups, and they were able to renovate it to this stage in which we are now.
It means we need more furniture to furnish it. We have written to the office, the GES, and the district assembly. We also told them, they said there's no more room for furniture until they procure some. We are also seeing to it that we can go to some benevolent societies like some of our leaders in the community that can help. If the furniture is provided to us, learning situation will just change drastically, and people of Mangwe, the next time you come, you see them better off than as we have now.
Let me come down to Greater Accra and zoom in the Adenta Municipal. The DCMC in Adenta Municipal took advantage of the training we offered them on the budget tracking and analysis, and submitted inputs into the medium-term development plan of the Assembly. They are tracking to see how these inputs are being implemented. The District Citizens Monitoring Committee also undertook monitoring, particularly with the Fafraha Health Facility. It didn't have electricity, and so the people called for the Assembly to extend electricity to the facility and also to wall it too, so that it will be more secured. They have extended electricity to the facility, they have walled it, and they have helped the facility to have accreditation so that people can use their NHIS card accessing healthcare in the area. And so those are some of the examples. There are quite a number of them also from Northern region and the Upper East region.
One thing that stands out so distinct has to do with the dashboard St. Ghana produced.
If you've been on St. Ghana's social media accounts recently, you've seen our social accountability platform photo. So, what is our social accountability platform all about? If you have any concerns about health service delivery, education, finance, or local government, you can now have your say by flashing our automated hotline or sending an SMS or by visiting our website.
It's a platform that at the local level, one can assess if he has any problem or a challenge. He can send his grievances or his questions or his issues, put them across on the dashboard. This is sent to the respective ministries or agencies who are in charge. To me, it has really, really helped a lot. Assuming there is a problem in any school, at the local level, somebody can easily send or ask any question, and the feedback is sent to him on this dashboard platform.
Since we want to promote good governance through the use of ICT, we are going to maintain our social accountability report card, advertise, sensitize the public to continue to use it, and get assemblies to also respond to the issues. We have learned quite a number of lessons from strategies we have used, and we intend to keep them going forward as part of sustaining gains of the project. The PMNE is not going to be dissolved with this project. And lastly, to sustain the gains we've made, we would continue with our peer learning exchanges so that what we do as an organization with citizens would add value to the work of the sector ministries and the MMBs, so that they would in turn use what we have shared to improve on service delivery, to add value to the life of their citizens.